Hi, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined today by pandemic expert Dr. Carlos Del Rio, Executive Associate Dean of Emory University School of Medicine at Grady Health System and Professor of Medicine, Global Health, and Epidemiology. Welcome back, Dr. Del Rio. I know you've had a very busy couple weeks, so thank you for taking the time to join us this morning.
Happy to be with you.
We have a lot of questions, as always, that came in before we began today, but I wanted to start with talking a little bit big picture. We know that cases are up, in some cases dramatically, in many states across the country. If you can talk to us about how we are doing here in Georgia, and maybe, what we're doing right and what we're not doing right.
Well, I think there are a couple of things. First of all, I think the more we see this virus, the more we learn how unrelenting it is and how it really transmits very rapidly, and how we need to keep our guard up. I think that we are doing certain things right here in Georgia. We have prepared our hospitals. We have bed capacity. We have personal protective equipment, so we're protecting our healthcare workers. We have expanded testing significantly in the state and have made it easier for people to get tested. I think we are not doing well in I would say many in the population still not taking this virus seriously. And my concern is that we're not using face masks as much as we should. We are pretending everything is back to normal when it really isn't. And we are not, we are sort of watching what I see as a slow-moving tragedy happen, and saying, and a little bit of sort of a giving up attitude. I think many of us, I see a lot of people saying, well, it's going to get us regardless, and we just need to live with it. And I think we need to be a little more proactive. I think we need to be a little more purposeful and say, no, we can actually stop this. We can actually do something as an individual and as a community to prevent this from happening. And I call on everybody to really think about, what am I doing as an individual? What am I doing as a family? What am I doing in my work to really prevent outbreaks of COVID-19? Because I would tell you, being in the hospital and seeing patients, you don't want to get sick. You could potentially die as a consequence of this. And really, I see every infection as a failure of public health and a failure of us as a society.
To touch briefly on what you said about face mask, anecdotally, I see it's still a big argument, for lack of a better word, on social media. Very divisive. A lot of people who are against wearing them posting what they say are studies and data showing that it's harmful to wear a mask, it's harmful to inhale your own expelled air. In your mind, is there any debate to be had on wearing masks at this point?
There isn't. I mean, surgeons have been wearing masks for years when they're in the operating room. And, a lot of them I know a lot of them, and I have not yet to see any harmful effects from wearing masks. And believe me, they operate for hours on end wearing a mask. This is their life. They've done this forever, and there's absolutely no evidence of harmful effect. I think that the evidence of how much it will help is what is still, I think, debatable. Some people say will help a little. Some people say will help a lot. But I think there's clearly evidence of helping. To what extent, we're not absolutely sure. There's no evidence of harm. So when you have something that has no harm and clear benefit, I think that there is, in my mind, the risk-benefit ratio is very clear. In my mind, also, wearing a mask is a way of me telling you, I care about you, because the reason I wear a mask is because I don't want to infect you if I happen to be infected. I want to prevent transmitting it to you. So it's also a sign of caring. It's also a sign of reminding people that something is going on. And in my mind, it's also a sign of being a responsible citizen. Now, if you don't want to wear a mask, and masks sometimes are difficult to wear, well, wear a face shield. Wear something that covers your mouth and nose, but do something that prevents your mouth and nose from being exposed.
Okay. Getting to the questions that came in before we started today, will we continue to see COVID testing through the fall? I've heard rumors that funding is ending soon. Can you break down the current numbers for hospitalizations and deaths, including age group?
Well, I think that we're seeing. Hopefully, testing will continue. We've ramped up as a country. We've done, I would say, a pretty good job ramping up testing. It was slow, but we're right now doing about 500,000 tests a day. Some people say we need to be doing more like 1 million tests a day. And some investigators from Harvard say we ought to be doing 3 million tests a day. I think 3 million is going to be tough, but I think getting to somewhere between 500,000 and 1 million is possible, and something we need to continue doing. And I think that there's funds and commitment to continue doing that. I think everybody is realizing the importance of testing. But as far as hospitalizations, we have seen a shift. We are seeing, if you look at the national data, hospitalizations are up, mortality is down, and it's down because we're seeing now younger people impacted. And when you see younger people, the mortality is lower. We're also gotten much better in taking care of patients. We've learned a lot. And with drugs like remdesivir, like dexamethasone, we can actually impact mortality that we weren't, some years ago. So research has also told us things we need to do for management that we didn't know 3 months ago. Mm-hmm. So I think that we've gotten better in decreasing morbidity and mortality, but we need to prevent hospitalizations. I think with hospitalizations going up, I see cities like Houston. I've been talking to colleagues from Houston yesterday. I mean, their ICUs are at capacity, and they're having what I would call a New York moment. When New York in March, April was getting overwhelmed, and I don't think any of us want to be there. Quite frankly, it's a very, very distressing situation.
What about long-term health impacts of having COVID? I know you said that mortality is down, but I've seen anecdotally and written that you can have.
It's hard to know about. It's hard to know about long term when something has been around for 6 months, right?
Yeah.
I mean, I think we all want to study the long term impacts, and I think there's some hints that there may be some lung disease and there may be some other issues. I can tell you from people that I've talked to who have recovered from COVID, they continue to complain of significant fatigue. They continue to complain of significant lack of energy after many weeks after recovering. So I do worry about long-term effects, but the reality is we're close to what I would call long-term.
True. Are we still seeing children with Kawasaki disease symptomology due to COVID?
There are some cases, but I think the impact on children is much lower than what we were concerned about. I think there are some cases, and again, it's a complication that happens uniquely in children, but it tends to be more the exception rather than the rule.
What are your thoughts on children returning to school this fall with our current numbers? I have several versions of this question, by the way, from parents. And as a parent, one of the discussions is, if I have a choice, should I keep my kids home versus sending them?
It's a really complicated issue. And I think on the one hand, you can say, well, kids are unlikely to get sick. They may get infected, but they're unlikely to get sick. On the other is, if kids get infected, they could potentially infect others, adults, and those can get very sick. So it's hard to know. I mean, I think that efforts are going to be done. I think, school is probably going to happen, and it will depend on the school district. But I think, again, some places are in worse shape than others. And I think the local epidemiology is going to dictate what happens. I think we're going to have to go into what I would call maybe a different school schedule, and maybe it's a mixed schedule, and maybe it's somewhat online and somewhat in person. But I mean, there's got to be some flexibility in what we do. And I think, nobody really knows what's going to happen, to tell you the truth. I mean, I wouldn't have predicted where we would be today 3 weeks or 4 weeks ago.
Right. Studies out this week seem to indicate that immunity after recovering from COVID-19 may last only 2 to 3 months. What are your thoughts on immunity or reinfection?
Well, I mean, I think that we need to have more data. I think we see that people that had mild disease or asymptomatic disease are the ones that have very limited immunity. I'm not sure that's the case for everybody, but I think this is how long the immunity lasts is really important for vaccine studies, right? And I think as we're starting vaccine studies in a month, we would know more about immunity, and we are really going to see what happens if people are immune or not.
The grandparents really want to hug their grandkids. We visit with them outdoors and stay distanced. Visits end with air hugs. They wonder if it will be next year before they can have a real hug again. Thoughts?
I think that's probably the case. I think that we are getting back to what was normal, And believe me, something that I miss a lot is being able to hug somebody. And it's not going to be, it's going to be a year or more. I mean, it's going to be quite some time, unfortunately. I think we need to learn about ways to communicate and to be with people that are not necessarily expressing our contact that way. Now, we can certainly do do alternative hogs, and we may be able to hold a hand and do other things.
Right. What is the average amount of time that it takes for an elderly person to clear the virus? Patients in long-term care who have been assigned to a COVID unit in the facility have difficulty meeting the criteria of 2 negative tests spaced 14 days apart, although they do not have fever or other symptoms and are lingering there until they die of COVID or some other illness, essentially without any treatment and never being allowed to reunite with their families.
Yes, I think we're learning a lot about that, and I think most of us now are pretty convinced that waiting for 2 negative tests is not necessary. People that are COVID, that have recovered from COVID and that are 10 to 14 days out of their initial test and who are more than 72 hours out of symptoms don't need. I mean, they may be testing positive, but what they're testing is not virus, but it's simply viral fragments, and they're not infectious. So I do worry about putting such a stringent criteria that is limiting what people can do and essentially keeping them in isolation unnecessarily.
The kids have to go back to school. What do we need to buy for them? A, mask, B, face shield. What pops into your mind that we need for our kids?
I think we need to show kids how to use face masks. I think shields may be important. I think I'm becoming more and more convinced that shields are probably a good strategy. And then we need to teach them. I mean, this is a good opportunity to teach our kids how to wash their hands and how to do it correctly. I think if we do those 3 things, we're going to be in good shape.
I'm planning to go on a driving trip next month to visit my daughter for a week. While our major outings will be the grocery store and Home Depot, should I plan to self-quarantine when I get home? And if so, how long?
I think if you are simply doing what you're doing and you're taking care and you're making sense, you don't need to do that. I would say, again, if you're going to go out, rather than self-quarantine, if you go out, wear your mask. I mean, this virus is everywhere. So, be outside and wear your mask. That's how you prevent from transmitting to others.
Is sitting outside at a restaurant okay now?
I think it's safer to be outside than inside. And I think if you're a distance from other people, it's probably okay.
Would you recommend wearing a mask while sitting outside at a restaurant?
Well, it's hard to eat with a mask on, right?
Right, I know.
But I think if you're going to be eating, sitting outside is probably okay.
Any validity that people with blood type A have more severe symptoms with COVID-19 than other blood types?
There is a couple of studies suggesting that blood type A have more severe disease, that blood type O have less severe disease. I'm not sure that's an epidemiological association. I'm not sure that it's a causation. But more importantly, I mean, it's not like we can go and change your blood type, right?
Right. This question's a little long, but I think of a lot of people who are trying to plan vacations this summer. So we have been very careful, stayed home almost constantly since mid-March, wore masks and gloves faithfully when out, washed our hands many times each day with hot water and antibacterial soap. We have no symptoms of COVID-19. We want to visit with some friends over a camping trip. We know that they have been careful too, and they are asymptomatic as well. We will be in close contact with each other for 4 days on the trip. Significant time in the car, sleeping in a large tent, hiking together, meals together, campfires, etc. We really want to go. Is it reasonable? If so, what sort of precautions would you recommend beyond mask and other ordinary precautions?
I mean, I think if you have taken care and you're not infected and so have your friends, and there is that sense that, everybody's fine, I think you can start, you can create what I would call your coronavirus. And my friend and colleague, Dr. Kraft, talks about this, this coronavirus bubbles. You can create your coronavirus bubble, safe zone, in which we're all not infected and we all are with each other. And that's okay. That's a good way to think about it. And I think you will be fine.
Okay. I heard someone else call it quarantine.
Yeah.
Quarantine, which I
love.
You
do your quarantine, you are in your safe bubble.
Should Governor Kent mandate masks in public areas?
I think that will be a very good move. I really think that, it's a simple thing. It's something that I'm surprised that we have not done as a nation, and I'm disappointed that our leaders have not stepped up to say this is the right thing to do.
In your opinion, do we need another lockdown? Numbers are getting bad in Georgia.
A lockdown, we saw the tremendous economic impact of the lockdown. What we need is to safely open. I mean, I think we need to think about what is right and what is not right. And there's certain things that are lower risk than others. And I think if we had followed the recommendations set forth by the White House, by the CDC, the problem is we just opened, like we said, okay, it's over. Let's open everything. Let's go bowling. Let's go to the movies, not wear a mask. This is the problem was what we opened in I would say in a very responsible way. I think we could have done this. It's almost like we said, well, it's time to go down the highway and take off the brakes.
Right. So when you look at Texas or Arizona, Dr. Del Rio, and you see their huge spikes, I think a lot of people wonder, well, why did that happen? Because many of us opened in a similar way. So when you look at those states and they're having these huge cases, what occurs to you that is the reason for it?
I think there's a lot of people looking at that and trying to understand it. I think there's several things. Is the impacted population, and I think it's about again, this is a disease of enormous disparities, and it's impacting disproportionately people who live in crowded conditions, people who are poor, people who are not necessarily able to isolate themselves and to telecommute and to telework. I think number two is you have we all sort of, I talked to friends in Texas and other places, and they said everybody went back to normal, like if nothing was going on. Everybody said, okay, time to resume our activities. I think we forgot that this needed to be a stepwise approach. I think that the way in which we opened was not responsible, and again, as a result of that, we're paying the consequences.
How worried should some with asthma be in terms of being in public?
Can you repeat that?
How worried should some people with asthma be in terms of being out in public?
There's no data that people with asthma do worse than others. So I would be just as worried whether I had asthma or I had COPD or I had any other lung condition.
How are super spreaders being quarantined once detected by tracers?
Well, again, you don't detect a super spreader until you find the event, the super spreading event, right? We don't know who's going to be a super spreader and who isn't. It's only after the event that you discover a super spreader. I think everybody who tests positive needs to be quarantined, whether they're going to be a super spreader or not. And you quarantine them to prevent a super spreading event. I think by testing, what you want to do is you want to diagnose people. And I think we need to be convinced that we're going to see cases. Mm-hmm. But we need to prevent outbreaks. And I think that's what testing does. Testing allows you to diagnose somebody and to rapidly put them in isolation.
How safe is taking a transatlantic flight? We will be sending our daughter off to college this August.
My niece, I've said this over and over, my niece lived in Milan. She flew back to Mexico. She flew from Milan to Amsterdam to Mexico. I think, wearing a mask, wearing goggles, taking hand sanitizer, she was fine. So you have to take the necessary precautions. This is not normal times.
If you wear a face shield, do you also need to wear a mask?
I think for added security, it may not be a bad idea. But it depends on the type of face shield. There's some face shields that have better coverage than others.
How frequently should people be tested to check for asymptomatic infections, COVID-19, i.e. like every 3 months for HIV testing? Have guidelines for this been created?
Guidelines have not been created, and I think we really don't know how frequently you need to be tested for asymptomatic transmission. I wish we had an idea, but we really don't.
This person's question is, if you've been diagnosed as positive, is hospitalization always necessary?
No, in fact, if you think about everybody that gets infected, about 80% of people have mild disease to asymptomatic to minimally symptomatic disease, and they don't need to be hospitalized. In fact, they may not even know they have it. And that's the problem, because they get infected and they are transmitting to others. Only about 20%, 15 to 20% of people need to be hospitalized. and only about 3% of people end up in the ICU. So the reality is that the numbers are in favor of most people being asymptomatic or mildly symptomatic. The problem is that those people are still transmitting. So that's the challenge. I mean, I wish it was a disease that everybody got really sick and ended up in the hospital, because then you wouldn't have so much community spread. But the problem is I couldn't be sitting here feeling totally fine and yet be infected and be transmitting to others. And that's why you wear a mask. You wear a mask because you don't know if you've been infected, and you simply don't know it. And unless you can test yourself on a daily basis, you're not going to know.
Right. You've definitely answered several of these questions before, but I feel sorry for this person. What's your recommendation regarding takeout food? I've been nervous to order thus far, but have now cooked dinner over 100 nights in a row! Exclamation point.
Congratulations. I think you're probably eating healthy. And I've seen a lot of cooks come out of this pandemic. A lot of people that have learned how to cook out of this pandemic, and it's interesting to see on Instagram and other places how creative they've gotten.
Right,
but takeout is fine. I mean, I think you can do takeout, and I think it's important because we're supporting our local restaurants. We're supporting people that need that business, and I would think that you want to do that.
What do you think about going to hair salons or playing tennis, walks in the park, if you are at higher risk?
Well, again, if you take the adequate precautions, I think all the activities that you mentioned, walk in the park, sounds pretty safe to me. And are you walking by yourself, or you're walking in a very crowded park? So, but walking in the park, with not a lot of people, safe. Going to the hair salon, if you wear a mask and your hairstylist, hairdressing person wears a mask and a face shield, you're probably okay. There was a very interesting episode. I think it's in Missouri. I think I can't exactly remember where it is.
At the Supercuts or whatever.
Right.
Where the two people were infected. Yeah.
Yeah. The person cutting hair was infected, but was wearing a mask and a face shield. This person had over 148 clients who were also wearing masks. None of the clients got infected. I think it's a really good example of how masks work.
Yeah, it is fascinating. I paid a lot.
It's not only fascinating. It's, again, I go back to the point. It shows that if both are wearing a mask, you decrease transmission. And yeah. I want people just to understand that it's not that complicated.
Exactly. An RN friend is ready to quit over poor safety behavior from coworkers, under the heading of, right, everyone's human and fallible. Are we at risk of losing much needed healthcare workers?
I'm very concerned about our healthcare workforce. We are stretched. We are strained. These are difficult times. We have a commitment to do our job. We're doing our job, but we need healthcare workers need your support. But what I would ask people is, don't clap for us. Don't cheer for us. Wear your mask. If you care for healthcare workers, do something and wear your mask. Be responsible. I mean, I think, this idea that we really care about our healthcare workers and we're going to have a parade and cheer for them, it's lovely, but that doesn't decrease the number of infections. As a healthcare worker, I want to see infections go down. And as I see infections go up, as I see hospitalizations go up, I get stressed. I get disappointed. I'm getting concerned. I mean, I don't want to see people with COVID in the hospital. I'm concerned about it. I am tired about it. And I worry that we're simply not doing what we need to do as a society to be responsible and to prevent this epidemic. We see what other places have done and have done it well. Why can't we do the same?
There was that graph I saw this week about cases in the European Union versus the United States, and it showed the dramatic difference. What do you think when you look at that? Why are their numbers on such a downward trajectory and so low, and we're not?
Because they had leadership. They had decisive leadership. They had bold leadership, and they did the right thing. Our country has had a total lack of leadership, and the lack of leadership is costing us and is hurting us. The combination of a population that is Americans are incredibly, self-centered and care about themselves, right? I mean, my rights. It's my right not to wear a mask. In many countries that's not allowed. It is not your right. You have to wear a mask. Right. And I think, this idea of individualism combined with lack of leadership, is causing the U.S. epidemic to be where it is.
I read recently about how people railed against seatbelts in cars, how there was a huge movement because of personal freedoms, and it made me think of now with the mask.
It's absolutely it's exactly the same.
Mm-hmm.
And, but eventually we got over that. But I'm sure, many thousands of people that shouldn't have died in traffic accidents died as a result of that.
Right. As a teacher, how can I make my classroom as safe as possible for my students? That's a tough one.
Well, I think you teach your students how to wear a mask. You wear a mask yourself. You do hand sanitizer. You social distance your kids. You separate them in the class, and you set example. I think teachers have an incredible ability to set example. Right? That's what we do as an educator. It is my job to set the standard and set the example, and I think teachers can do that.
What is your opinion on resuming youth sports?
Well, I mean, I think, there are sports and there's sports. I think it's not all sports are the same. Tennis, probably good. Wrestling, probably not.
Right. I need to fly to West Palm to help my mother. What extra precautions can I take? 2 planes and a taxi. Is a cloth or sterile mask better?
I would use a mask. I would use goggles or a face shield. And I would take hand sanitizer and practice social distancing. In other words, when you're in the airport, get in a corner, get away from people. If you need to, if you're in line to get on the plane, have social distance. I mean, I think we need to be reminding ourselves of what are the smart things to do. And again, it is like the commandments, right? This is what you need to do. It's not rocket science.
Yeah.
Wear a mask, wear goggles, hand sanitizer, wash your hands, take wipes, clean everything, and practice social distancing. You will be fine.
Another travel-related question. I don't own a car and haven't left my neighborhood in months because I'm worried about riding MARTA. Thoughts on public transit? Are shorter train rides under 10 minutes safer?
I think, again, are you in the train when there's thousands of people, or in your train with very few people? I think it's short, but it's also the density, right? Mm-hmm. This is about density. I mean, I think that crowded conditions are not good for this virus. Close environments are not good for this virus. So crowding, close environments, long periods of time are ways in which this virus gets transmitted.
What if my coworker healed from COVID-19? Should she be allowed back to work? Is she contagious?
Once your coworker is recovered, she's not contagious, and yes, she can be allowed back to work.
Tough question. What do we do with toddlers? It's impossible to get them to wear a mask.
Oh, it's totally impossible. I think it's very hard, and I think that, I don't know the answer to that question. I think that, again, toddler is, you don't want to put a mask in somebody under the age of 2, first of all. And I think you just have to keep them close to you and keep them isolated, and they're part of you.
Do you recommend wearing a mask when exercising outdoors?
Again, depends what you're doing. If you're going to be outside walking or running, no, you don't need to wear a mask. I think, it's as I said, the contagious of this virus is by being in close environments, in close proximity with a prolonged period of time.
What if schools do not require masks? What are your thoughts on that?
I think it's bad. I think it's a bad move, and I think it's irresponsible of that school district to do that.
Dr. Del Rio, I'd love to end our time together today and ask you to talk about something that occurred to me as we were talking. I believe at one point during our Facebook Lives, you told me, is it that you have a daughter and a daughter-in-law who are pregnant?
Yeah, correct.
So we talked a little earlier in this Facebook Live about not really being able to hug people. And I'm wondering if you're keeping your distance from your loved ones, especially with the nature of the work you do. So that's one part of what I'd love to hear from you on. The other part is, if we have a vaccine, optimistically, the beginning of next year, 2021, how many months after we have a vaccine can one assume that things may begin to look or feel a little bit more normal? So I know those are two disparate topics.
Well, I mean, I think
we need
together.
I think we first
need to have a vaccine that works, and we deploy it and vaccinate people. Once we have reached about, I would say about 40-50% of the population vaccinated, assuming the vaccine works and it's effective, I think things could start getting back to normal. So realistically, next summer. If everything goes well, next summer may be back to a normal summer.
Okay, so a year from now.
Yeah, I think so.
And what about this is what you were
Well,
talking
about. My kids are, one is in Miami, one is in New York. I haven't seen them. I saw them last time. I think sometime in January, and have not seen December, January. Have not seen them since. Right. So I think that yes, I want to see them. I want to hug them, but I also realize where we are and what the issues are, and I miss that contact. But we've gotten very good at Zoom, and we communicate more than we ever did before via Zoom and FaceTime and other things. But the reality is that this is very difficult, and I think it's emotionally very difficult. And I think the emotional strain that this epidemic puts in all of us is something that we need to continuously think about, and we need to continuously realize that these are not normal times. There's a lot of anxiety. There's a lot of depression. There's a lot of uncertainty about the future. There's a lot of lack of that emotional support that we all need. And therefore, we have to figure out a way to be kind, to be caring, and to think about others. And again, I will go back and say, if you think about caring, if you think about being kind, if you think about wanting to get back to normal, let's all work together and do that. Let's be responsible. Let's wear our mask. Let's practice social distancing. And let's do it. It's in our hands. It's in nobody else's.
I have friends who have said that they feel like reality is really hitting right now, that this isn't over anytime soon, and that they're very low. Have you had any of those feelings yourself throughout this?
Well, I knew from when we started seeing this that this was going to be for the long haul, that this was not going to be short, and this is going to take some time. But it's what's really depressing to me is to see that we as a country have failed in the response to this epidemic. And that, to me, I think is the toughest part, because when you are in a battle, and again, this virus, we are in a battle, and you realize that you're losing the battle, it's very depressing. And somehow I think we can do better, and I know we can do better, because we have smart people, we have knowledgeable individuals, we have caring people. This country's full of people who care and want to do the right thing. So it's to me a very concerning and a very disappointing time to see that we're losing. And my plea is that we bind together and we say no, because failure is not an option.
Right. Dr. Del Rio, thank you. I've missed you.
Good to be with you.
I'm glad you're back this week, and I hope that we get to see you next week. Thank you for your advice and consult. I know it means a lot to all of us. Continued good health, and we'll see you soon.
The same to you. Have a good day.
Thank you. All right, everyone. Be safe, be well. See you soon.